Hello and welcome to Season 5 of the NGO Whisperer show. My name is Dr. Carolyne Opinde. I'm the founder of the NGO Whisperer and the convener of the NGO Whisperer Masterclass, the official sponsors of the NGO Whisperer show. Here at the NGO Whisperer, we provide technical support to nonprofits and social enterprises so they can successfully impact people's lives. Season 5 of the NGO Whisperer show is dedicated to the NGO Whisperer Global Fellows Class of 2021. And today we have the honor and the privilege of having Nkatha Mugao, the founder of Frolics of Hope Africa, joining us from Nakuru, Kenya. Nkatha, welcome to the show.
Thank you so much, Dr. Carolyne.
It's indeed a great honor and a pleasure. Nkatha, share with us what inspired you to step into the nonprofit sector, having been trained in the financial industry and worked in the financial industry. Why did you decide to step into the nonprofit sector?
Well, I call myself a product of mercy, and because I also is a beneficiary of someone's mercy and them giving the donations and support towards my education, I also decided that it was about time, after working for like around 9 years in the financial sector, it was about time for me to give back to the community and, you know, give it forward to our child in need of care and protection.
Would you share with us what is the focus of your work? Who are your beneficiaries? Who are your partners? And what impact have you had so far since your founding?
First of all, our key main beneficiaries are children aged between 0 to 18 years, drawn from all over the country and sometimes beyond the boundaries, because we deal with children who've gone through violence, abuse, kidnapping and trafficking, early marriages, and female genital mutilation, FGM. So since we started this organization in 2018, we've directly impacted more than 800 children so far. And we have also offered support to families, especially those who've gone through human trafficking, to more than 2,800 families this far. So our key partners have actually been the NGO Whisperer in capacity building. And of course, we have the police, we have the community itself, we have other corporates that have stepped in to help us, especially financially, because the organization, the rescues actually take a lot of finances. But, you know, with them coming on board, we've been able to reach out to very many children who would be at a loss if they were not, you know, rescued within the right time. So the NGO Whisperer actually has played a key role in helping us put up the structures and, you know, be able to monitor and evaluate our steps every step of the way. And so far that we've also managed to put up a strong team that has been able to respond faster to cases of rescue and you know, reintegration services for these communities.
You mentioned that you work across Kenya, and I know there's 47 counties in Kenya and beyond the borders. Would you give us an example of what it takes to do a rescue mission for a child who is undergoing abuse or has been abandoned to the point where they are reintegrated back into the community?
I'll give you a very recent example of a baby that we had, you know, the mother had given them this illicit brew, and they had even gone to a coma. And, you know, to some point, you know, this baby needed emergency rescue. So when the neighbor called us, because you see the mother was also very drunk, so she left the child at her door. So when this neighbor called us, it was actually past 11 p.m. and guys were asleep and everybody is, you know, like so shocked that there's a baby that is not even responding to any help, any support, because they had tried giving the child milk and she wasn't responding. So we had to take our vehicle. That means that we have to have a car that's ready on standby, and then we also need to have fuel ready for this car, and then we also have to have a 24-hour available driver. Either they work on shift or something, so they are able to attend to these cases. So we had to respond very fast. And that also means that we have to incur other costs, especially making sure that this child is given emergency response at the hospital, and they are also treated to recovery fully. So that means actually, like on that case alone, we spent more than 30,000 Kenya shillings in terms of medical care alone. And then we also had, if you factor in the issue of fuel, you factor in the driver, the timing costs and all that, it is actually a case that you could say that on the lower end, we spent more than 50,000 Kenya shillings. That's about $500 US. It actually takes like a longer time to do a response, especially if you're talking about a case that is outside of Nakuru. This one we were able to respond faster because our headquarters is in Nakuru, and unlike where we have just the CRVs responding, that is the community response volunteers. When we have them responding, and these are guys who may not even be able to afford a vehicle, then it makes it very difficult for this case to be responded to on time.
What systems are in place to support you? What systems has the government or the county government put in place to help you respond immediately to such cases?
There are no mechanisms at the moment. We just work with the children department. Sometimes, it's government offices. So when they are closed, sometimes they tell you they cannot be able to respond. But at least the Kenya police have actually been very helpful. Sometimes you call them in the middle of the night, and, in as much as they may not be able to tell you that we can run there, when they have a vehicle that is ready, then they always avail it to us to use. So our community response volunteers are able to respond to the case using the government vehicle. But as for the county government, there's very little that they have done actually, because even if you look at the current budget for the 2021-2022, there is very little money that has been allocated to the Department of Social Services, where the children department lies.
It is sad to see that there's still a lot that can be done, and yet, we are not moving at a faster pace. Now, you mentioned that you have impacted the lives of over 800 children between the age of 0 to the age of 18. What does that mean in terms of the work that you do?
That actually incorporates the rescue services. It incorporates the rehabilitation services, because the rehabilitation services, we do not just offer accommodation for the children when we do the rescues. We also make sure that they have access to psychosocial support, that they're able to get counseling and trauma therapy, that they're able to have access to good medical care. They have access to food, they have accommodation, they have clothing, and all the basic needs met. And some of these cases are not cases that we house at our rescue and our trauma center. Sometimes we do the rehabilitation from the community itself. So if it's a case that is not, so severe as per the parameters set by the government and of course by Frolics of Hope, then we are able to do the rehabilitation both of the family and the child within the family setup. Because at the end of the day, as an organization, we hope and we pray that every single day we are able to maintain family as a unit. That's why we have the rehabilitation and then the reintegration process.
How does the reintegration process happen?
Usually the reintegration process starts just like a week or two before the end of the rehabilitation process. So that time is when we notify the child that we'll be taking them back home. And then we have the social worker verifying that indeed the family is ready for reintegration and they're willing to take back the child. They're willing to support the child. They're willing to continue with their parental classes and counseling sessions. They are also willing to, take care of this kid without harming the child further. So once we are able to verify that, then the next couple of weeks, probably 2 or 3 of the coming weeks, we make sure that the child is psychologically set to go back to the community. And from there, of course, the social worker, the children office, the police officers, the area chief, they are all involved to make sure that they know that this child is going back to the community. And that makes it very easy for us to be able to monitor the progress of this child. So just in case we have a relapse, then we are able to run fast and, take over the case and make sure that the child is taken care of properly again.
I am aware that while the children are with you, they go to school like they would if they were at home. What support have you received from local schools to be able to take in these children? Because these are emergency cases. They're usually not planned things that happen, and you immediately have to take a child to school because they cannot sit at the rescue center while others are going to school. What support are you receiving from local schools, both primary and secondary?
The schools have actually been super supportive because we have several of our girls attending a local primary school here. And the head teacher or the principal has actually been very supportive in making sure that whenever we have such a case and the child is going to school for the first week, they are well incorporated in the class and they get the remedios just to be able to catch up with the rest of the students. And then they've also provided us with home materials for homeschooling whenever they're at home. So we are able to provide for them, that education, and they're able to catch up whenever they, in case they were left behind in terms of syllabus coverage. And then we also have other study materials that we use for the small ones who've not been able to join the school. And all these are materials gathered from the community.
On average, how many children go through your rescue center every year?
The minimum that we've actually had was about 83. And that was actually because of the impact of COVID and the lockdown and all that, because it made rescues very difficult during that time. And also you realize because of the challenges that COVID came with, we were not able to get, our donor funding in terms of individual donors that we depend on, and also corporates who are negatively impacted. So our finances actually kind of shrunk to a huge extent. So we were not able to reach out to a lot more cases than we expected, but at least we managed to reach out to at least 83 that we sheltered at the shelter.
The work that you do is commendable, Nkatha. We applaud you for the amazing work that you do, rescuing vulnerable children, rehabilitating them, and reintegrating them into their families or other facilities that would take them on. Would you share with us, now that you have completed the NGO Whisperer 6 months rigorous fellowship program, what inspired you to be one of our fellows?
Actually, the main reason that I loved, that I really anticipated and wanted to be part of the NGO Global Fellowship was the fact that, it was so tailor-made for the exact reason why I was kind of feeling stuck, because I didn't know, because, when you're starting a non-profit, sometimes nobody prepares you for the challenges that you're gonna face ahead. And me being a finance person, it was actually very difficult for me to transition. So the training actually came quite in time. It was very timely and it was very handy, because I've been able to put up put the staff together and be able to, have a routine for them to be able to deliver more and be more effective. Even sometimes when we don't have finances, we are able to maneuver around and make sure that, the little that we have goes into use pretty well and effectively deliver to the community.
Thank you so much for the positive feedback. Over the 6 months, there are many modules and masterclasses and trainings that you attended. What are the new areas of knowledge or insights that you gained during the fellowship program?
So monitoring and evaluation was actually one of our biggest challenges when we started, but that was prior to the NGO Whisperer Global Fellowship. But after that, I think we've already gotten our footing on the ground, and we can confidently now highlight some of the impacts that we've had, and we can see the transformation on the children as well. And that gives us the confidence to even, mobilize more funds, because you're able to account for them. Unlike before, when we couldn't, put a finger on exactly how we managed to help the children, apart from the rescue, of course, which accounts for the numbers. But the rest of the things did not make sense to us. But currently, as it is, I think we've actually gotten our footing, and going forward, we have the confidence to move on. I think the second module that I really, really loved interacting with was on leadership and mentorship, and leadership management and mentorship of the teams. So that one brought into perspective the number of people that we needed to have, and why they should be in that, that office where they're supposed to be. Unlike like before, when I used to do everything, it was more like a one-man show. But right now we have a team that's able to put, their work in order, and I do not have to, breathe down their necks every time, because that was one of the things that was covered at the NGO Whisperer Global Fellowship.
Wonderful. How has your organization changed so far, and what plans do you have for the future at Frolics of Hope Africa?
A lot has changed, because initially we could pick whoever that wanted to volunteer with us, without even looking a lot into what their technical expertise was, although we used to do the background checks on them because of what we do with the children. But apart from that, there wasn't anything major that we used to do. But right now, we have all the structures in place, and we are able to know who is doing what, who is handling what, and the outcome that we expect at the end of the day. And also, we have been able to keep tabs with our donors and update them on regular basis on how far we've come with the project, and what the challenges are, and what the impact we are hoping to achieve at the end of the project, maybe at the end of the year. And going forward, we actually have huge plans, because we're hoping at the end of this year we'll have managed to acquire a bigger piece of land, and probably build and start building a bigger place for the children, because there's a lot of kidnapping going on right now, and child trafficking. So we're planning on seeing how best we can be able to have a bigger space for these children who need us. And there's a lot of teenage pregnancies as well going on, because I think of the 1 year break that children had during COVID lockdown in 2020. So we've seen a lot of changes that are going on. And as an organization, we're trying to step into that space and make it a safe space where children can be able to, expel their challenges and be able to talk about what they've been through without feeling judged, and without feeling, that they're not in a safe space where they can talk about it. So as an organization, we're also hoping that within the next couple of months or maybe years, we'll be able to have, a bigger place for empowerment as well. Because, in as much as we're doing rehabilitation for the children, we understand that a lot of abuse, especially physical abuse of children that goes on, is because sometimes they are from families that is financially challenged, and so the parents are not able to take care of these kids. And constitutionally, it's not a crime to be poor. But again, you'll not have helped this child if you do not empower the family from the challenge that they actually initially faced, for the child to be at the place where the child is feeling abused. So we're trying to step into that space as well in a huge way. And so our empowerment plan is, planning on expanding into, fashion and design. We're trying to increase on Safi cleaning services. We are also trying to have on board some agricultural, projects that are going to be able to support these families whenever we can.
Nkatha, what last message do you have for the government of Kenya, for civil society organizations and good citizens on the work that you do around rescuing, rehabilitation, and reintegration of children who've been abandoned or gone through abuse?
One thing that I'd like to say, especially to the government, is because if a government does not, invest in its citizens, or rather invest in the children today, then chances are you are raising a weaker generation come tomorrow. And therefore, I would actually be very excited to have to see that the government increases the budget in terms of the Department of Social Services and Child Protection, because if you invest in these children today, you're going to reap the benefits tomorrow. And that would be a very nice thing to see, that a lot of these children are able to access their basic needs, and they're able to access support whenever they need it. And the other thing is we also need to start talking about children mental health, because a lot of cases that people are talking about, mental health in Kenya has always been a taboo to discuss. But as it is right now, because I think a lot of people have seen the impact of COVID-19 and the mental status of a lot of adults, then mental health is becoming a topic that a lot of people are discussing. And when we're discussing it, we end up forgetting that children also have a mental health aspect of it. And that's why you see a lot of adults are breaking down at adulthood, because their child's trauma, whatever that they went through as children, the trauma that they had as children was not addressed at that young stage. And therefore, they carried the pain and the troubles to adulthood. And a lot of them, end up committing suicide. Like I was looking at a case of a DJ who, took poison last night. And this is an adult who is actually like around 34 years. And he took poison yesterday at night just because, he had troubles in his family. And he felt like nobody could understand him. And as an organization, we're trying to demystify those myths, especially on childhood mental trauma. And therefore, I would be grateful to have this discussion going on along the way.
Thank you so much, Nkatha, for the amazing work you do. We are very proud to be associated with you and with Frolics of Hope Africa. You are a beacon of hope and a ray of light in a community that is going through a difficult time right now, especially during the COVID-19 lockdown. You've done amazing work and we commend you. And I know commending is not enough. We are asking organizations, corporations, government agencies to raise awareness and support for organizations such as you. And more so, we need finances. When we talk about resource mobilization for the work that you do, it is emergency work, so you need the money yesterday, not tomorrow. And so I'm urging good citizens, corporations who are looking at supporting this noble cause to reach out to you. Where can they find you, Nkatha?
They can find us on Facebook. Our Facebook page is Frolics of Hope Africa. They can find us at our website, www.frolicsafrica.org. And they can also find us on Instagram, on Twitter, Frolics of Hope.
Thank you so much. Ladies and gentlemen, there you have it. Nkatha Flora Mugao, founder and CEO of Frolics of Hope Africa, an organization that is rescuing, rehabilitating, and reintegrating abandoned and vulnerable children in Kenya across the 47 counties. She's also one of the NGO Whisperer Global Fellows Class of 2021, and we are very proud of the amazing work she has done and what she will continue to do in future. Thank you so much for joining us today for this episode. We invite you to subscribe to our YouTube channel and follow us on social media. Ladies and gentlemen, as always, it's all about connecting people, raising funds, and impacting lives globally.